Bonjour à tous. Good morning, everyone. Before I get started, special thoughts this weekend to an incredible mayor, Hazel McCallion. She is a force of nature, and she'll be celebrating her 100th birthday this weekend. Hazel, you have served your community for decades. It's no surprise that you'll be celebrating your 100th by supporting Trillium Health. Happy birthday, dear friend, and thank you for everything you've done and everything you continue to do. Je sais que pour bien des gens, il ne serait pas possible de passer le temps en personne avec leurs proches en fin de semaine pour la Saint-Valentin. C'est pas facile, la situation qu'on est en train de vivre, mais c'est une situation qui ne durera pas éternellement. On a fait beaucoup de chemin et on doit tenir le coup pour pouvoir passer à travers ensemble pendant un peu longtemps, un petit peu plus longtemps. Il y a de l'espoir à l'horizon, il ne faut pas lâcher. D'ailleurs, aujourd'hui, j'aimerais commencer par faire une mise à jour à propos des vaccins. A few weeks ago, I talked with the global CEO of Pfizer, Dr. Albert Bourla. Between that conversation and the excellent work done by Minister Anand, we have some updates to share today. We've received an updated delivery schedule from Pfizer that brings us to the end of March, and we can confirm we will be receiving the 4 million doses we've been committed to since last November from Pfizer by the end of that month. We will share this schedule with provinces and territories so they can prepare to get all those doses into people's arms. For the months following from Pfizer, we'll be getting the next doses sooner. We've brought forward millions of doses into Q2, so that we will receive 10.8 million doses of Pfizer between April and June, and all of our remaining doses of Pfizer in Q3 before the end of September. That is, we will have received 40 million doses from Pfizer by the end of September. That's part of the reason why we can say with such confidence that everyone who wants a vaccine in Canada will get one by the end of September. We've been continuing to work every single day on getting as many doses as possible, as quickly as possible, into Canadians' arms. On top of this news on Pfizer, I can also share today that we've purchased 4 million additional doses of the Moderna vaccine, which will be arriving over the summer. On a eu une mise à jour concernant les livraisons de Pfizer. C'est confirmé qu'on va recevoir les 4 millions de doses d'ici la fin mars. On va partager l'horaire avec les provinces et les territoires pour qu'ils puissent se préparer. Et pour le printemps, le Canada va recevoir des doses du vaccin de Pfizer plus tôt que prévu. Un total de 10,8 millions de doses entre avril et juin, et le reste des doses qui arrivera au 3e trimestre. Et en comptant Pfizer seulement, on va recevoir 40 millions de doses au total d'ici la fin septembre. Chaque dose de vaccin contribue à protéger les gens qu'on aime et à nous aider à traverser la crise. Je sais que vous vous demandez quand est-ce que vos doses s'en viennent. Bien, les choses s'avancent et vos vaccins s'en viennent. Aujourd'hui, je peux également annoncer qu'on a acheté 4 millions de doses supplémentaires du vaccin de Moderna. Ces doses, qui arriveront au cours de l'été, s'ajoutent aux 40 millions de doses qu'on prévoit recevoir de Moderna cette année. Au total, le Canada disposera de 84 millions de doses des 2 vaccins présentement approuvés d'ici la fin septembre. Alors, toute dose de AstraZeneca ou de Johnson & Johnson ou d'autres qui pourraient être approuvées dans les mois à venir seraient en plus de tout cela. Mais ces 84 millions de doses confirmées par les 2 vaccins approuvés avant la fin septembre, c'est pourquoi on peut dire avec tant de confiance que tout le monde qui veut se faire vacciner ici au Canada le sera avant la fin septembre. Just like vaccines, I know that border measures are also on a lot of people's minds. Recently, I had a great chat with Annette from Ottawa. She had written to me about people vacationing abroad and, as she put it, ignoring rules that had been in place for quite some time. Annette, today I want to tell you what else we're going to be doing about this. On a déjà travaillé avec les principaux transporteurs aériens au pays pour suspendre leurs services vers les destinations soleil. Je veux une fois de plus les remercier pour leur leadership dans ce dossier. Comme je l'ai déjà dit, on va être là pour eux et leurs travailleurs afin que les voyages internationaux puissent reprendre en toute sécurité dès que les conditions s'améliorent. In addition to suspending flights to sun destinations, international flights are now arriving at only 4 major Canadian airports. And no matter the flight, everyone must have proof of a negative PCR test taken within 72 hours of boarding. Starting today, people returning by land borders will also need to show proof of a negative PCR test taken within 72 hours before arrival. And all returning travelers must quarantine for 14 days after coming home or risk heavy fines and possible jail time. These are some of the strongest measures in the world. But with new variants emerging, we're stepping them up even further. Later today, Ministers Hajdu, Blair, and LeBlanc will announce the details of new testing, quarantine, and enforcement for everyone flying or driving back to Canada. These measures will take effect starting February 22nd. Putting these additional measures in place is a true team effort. To Canadian Airlines and border agents, thank you. To public health employees, to hotel workers and owners, thank you for all the work you're doing and for doing your part. On a déjà mis en place certaines des mesures frontalières les plus strictes au monde. Et avec la présence de nouveaux variants, des mesures plus strictes s'imposent. Plus tard aujourd'hui, les ministres Hajdu, Blair et Leblanc vont vous fournir plus de renseignements sur des nouvelles mesures de dépistage et de quarantaine visant les gens qui rentrent au Canada par avion ou en voiture. Ces mesures entreront en vigueur le 22 février. Le but de ces mesures, c'est d'assurer la sécurité des gens. Bien évidemment, il y aura des exceptions pour les déplacements essentiels, notamment pour les camionneurs et les travailleurs de la santé. Pour le reste, les gens ne devraient tout simplement pas voyager. On ne laissera pas les décisions irresponsables de quelques-uns mettre la vie de tous en danger. On va faire tout ce qu'on peut pour protéger les gens et pour maîtriser ce virus. These border measures will help stop the spread of COVID-19 and new variants. And that's not all we're doing on that front. We're also investing $53 million for an integrated variants of concern strategy to help monitor variants like the ones first detected in the UK and South Africa. You might be worried about these new strains. Well, we're putting our best experts on it. Researchers, epidemiologists, modelers. With investments like this, Canada is ready to detect, track, and treat new cases. I know you're probably watching the news these days attentively, as everyone is, and watching the positive sign of the cases going down across the country. That is a good step in the right direction, but we also know at the same time the new variants that are more communicable, more easily transmitted, are increasingly out there. So we need to stay careful. You are doing a great job, making the sacrifices necessary that have shown us on the right track, but we're going to need to stay vigilant. We're going to need to be careful if we're going to make it through this spring in the best possible way to be able to enjoy a better future for all, because nobody wants a third wave to start, particularly not one comprised of new, more communicable variants that can cause real challenges. Today, I also want to talk about what we're doing to support everyone, no matter who you are, during this global crisis. In the last year, we've seen once again how tough times fall first and hardest on the most vulnerable. The legacy of this pandemic must not be some people getting ahead while others fall behind. Instead, it must be a stronger, fairer Canada for everyone, and that includes for women and girls. Already, we've invested in everything from safe places for women and girls to stay to moving forward on an action plan for women in the economy. And we're not stopping there. As Minister Monsef announced yesterday, we're launching Feminist Response and Recovery Funding. This will support organizations that work to end violence against women and girls, that invest in their economic security and that empower women leaders. Personne ne devrait avoir à affronter cette crise tout seul. On a déjà investi dans des mesures de soutien pour les personnes qui travaillent dans certaines des industries les plus durement touchées, comme celle du voyage et des arts de la scène. En septembre, on a annoncé le lancement d'un fonds d'indemnisation pour les plateaux de tournage en cette période de pandémie. Depuis sa mise en place, ce sont des milliers d'emplois qui ont été conservés dans les industries du cinéma et du petit écran. Et cette semaine, le ministre Guilbeault a annoncé que le fonds sera prolongé jusqu'à l'année prochaine, soit le 31 mars 2022. Peu importe qui vous êtes, on va vous apporter le soutien dont vous avez besoin. C'est pour ça qu'on a lancé la PCU en mars dernier. C'est pourquoi on a créé la prestation canadienne de la relance économique et prolongé la subvention salariale. On est prêt à vous fournir le soutien nécessaire aussi longtemps qu'il le faudra. Better days are ahead of us. On that note, I want to end this morning by wishing everyone a happy Lunar New Year, particularly to those from East Asian communities. The Year of the Ox is particularly apropos for this particular time we're in, as it's about hard work, perseverance, and trustworthiness. I think that's exactly what's going to get us through the coming months. Instead of lion dances and fireworks, this year you might be celebrating by delivering PPE to frontline workers or dropping off groceries to elderly neighbors. Every day, you remind us that diversity is our strength, and it's something that we will always defend. There's no place in this country for hate or racism. We will always stand against anti-Asian racism and against all forms of racism and discrimination. We are stronger together today and always. Bon nouvel an lunaire tout le monde. Kamun, Sheshe, Kamsahamnida.
Thank you, Prime Minister. We'll now go to media for the questions. One question, one follow-up on the phone. Operator.
Thank you. Merci. First question, Alex Ballingal, Toronto Star. Line open.
Hi, good morning. Thanks for taking my question. Just you mentioned you got the delivery schedule and the confirmation for Pfizer up to the end of March that we'd get the 4 million. I know obviously Moderna's been delayed too. Do you have any update about will we get the 2 million Modernas by that point, by the end of March, or what's the deal with Moderna?
We continue to get assurances from Moderna that they will be able to deliver those 2 million doses they had committed for the end of March. But we will, of course, continue to follow up directly with the company to make sure that we can get those doses as soon as possible and indeed secure more and sooner doses for all Canadians. Je peux confirmer que Moderna continue de nous dire qu'ils vont pouvoir livrer ces 2 millions de doses avant la fin mars comme prévu, mais nous allons continuer de travailler de façon étroite avec eux pour s'assurer qu'on reçoit ces doses et peut-être même plus de doses dans les mois à venir.
Follow-up, Alex?
Yeah, this week you had a conversation with the Indian Prime Minister Modi. In the Indian government's readout, they said that you called him and told him Canada needs access to India's vaccine. Does Canada need to source its 20 million AstraZeneca vaccines from India? And just can you tell us what exactly you said to the Indian Prime Minister?
We have a deal, as you pointed out, for 20 million AstraZeneca vaccines. Those are not from the Indian production facility. I believe they're from the AstraZeneca facility in South Korea, but others can confirm that. We are looking at possible extra vaccines coming from India, from the Serum Institute. Work is being done closely on that. It was good to talk to Prime Minister Modi on a range of subjects, including the role that India is playing in producing vaccines for the developing world and other issues that are important to us. We will continue to work with people around the world to ensure that we're solving this pandemic for Canadians and indeed for everyone around the world. je peux confirmer que les doses, des 20 millions de doses d'AstraZeneca que nous prévoyons recevoir dans les mois à venir viennent pas de l'Inde, mais nous sommes toujours intéressés en recevoir d'autres d'ailleurs. C'est pour ça que c'est une bonne chose de parler avec le gouvernement indien et poursuivre des possibilités avec le Serum Institute en Inde. Nous allons continuer d'échanger avec tous nos alliés, nos amis à travers le monde pour s'assurer qu'on a le moyen de passer à travers cette pandémie le plus rapidement possible. Et les Canadiens et tout le monde dans le monde, nous devons travailler ensemble et c'est exactement ce qu'on va continuer de faire.
Merci. Prochaine question. Operator.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Bonjour, M. Trudeau. D'après un sondage Angus Reid, il y a moins de 30 qui vous croient quand vous promettez un vaccin pour tous d'ici la fin septembre. Bon, évidemment, c'était avant l'annonce d'aujourd'hui avec des chiffres. Il en demeure pas moins que c'est une de vos promesses les plus importantes. Je sais qu'on est dans un gouvernement minoritaire, mais est-ce que vous vous engagez à ne pas dissoudre le Parlement d'ici septembre pour que les Canadiens puissent vous juger là-dessus spécifiquement?
Notre priorité, c'est de vacciner le plus de gens possible, le plus rapidement possible. C'est ce sur quoi nous travaillons. Je comprends qu'il y a des anxiétés que les gens sont en train de ressentir. Ils voient des interruptions temporaires qu'on a eues depuis une couple de semaines et ils s'inquiètent pour les mois à venir. Mais je peux vous dire que dans les semaines à venir, on va commencer à avoir une augmentation énorme dans le nombre de doses qui commencent à arriver au Canada jusqu'au printemps et jusqu'en septembre, où nous sommes absolument en voie de recevoir assez de vaccins et encore plus pour pouvoir vacciner tous les Canadiens qui le veulent. Notre priorité, c'est ça, et c'est sur ça que nous allons continuer de travailler à chaque jour.
Suivi?
Oui, ben je comprends, mais ça ne répond pas à la question. Est-ce que vous vous engagez à ne pas dissoudre le Parlement d'ici le mois de septembre pour que les Canadiens puissent en faire une espèce de question référendaire sur la vaccination?
Mais notre motivation, c'est pas est-ce qu'on va avoir l'approbation des Canadiens. Notre motivation, c'est de vacciner les Canadiens le plus rapidement possible. Je comprends, Mélanie, que vous avez un intérêt particulier à la politique. Mais nous, en tant que politiciens, en tant que gouvernement, notre intérêt, c'est de vacciner le plus de gens le plus rapidement possible. Alors, je ne vais pas plonger dans des hypothétiques. On va avoir comme focus, on va avoir comme priorité, ce qu'on continue à faire, c'est de livrer des millions de vaccins aux Canadiens dans les mois à venir et de s'assurer que ce soit très, très clair que tout le monde va pouvoir être vacciné d'ici septembre.
Thank you. Next question, operator.
Thank you. Merci. Next question, Brett Forster, APTN News. Line open.
Hi, Prime Minister. APTN News has obtained hundreds of DFO documents from the September launch of the Mi'kmaq moderate livelihood fishery that reveal law enforcement was unprepared and unresourced to respond to the vigilante protests that they knew were coming. The RCMP had one boat. The protesters had 150 at one point. The Coast Guard was still in transit. And DFO officers have been instructed to observe, record, and report. Are you going to hold anyone accountable for that?
I think all Canadians expect our police forces to be able to respond to difficult situations rapidly and in a way that demonstrates their ability to keep Canadians safe. There are a number of questions being asked about what exactly happened and about the RCMP response around the Mi'kmaq protests and the protests of Mi'kmaq, and we will make sure that we get those answers, not just for the government, but for Canadians.
Follow-up, Brett?
Yeah, can you just explain a little bit what that means? I mean, are you going to personally seek accountability from the federal agencies that allowed this to happen? And if not, what does that say to Indigenous communities who saw the RCMP and the DFO stand by as this violence unfolded?
I think there are questions for all different jurisdictions and the police of jurisdictions involved in this. We've certainly worked very closely with the Mi'kmaq over the past many months to resolve this issue and bring non-Indigenous fishers along. It is unacceptable to have seen any form of violence and intimidation of Indigenous fishers in this situation, and people have questions that they are expecting answers to, and I am one of those people.
Bonjour, M. Trudeau, Louis Blouin de Radio-Canada. Est-ce que vous avez pris une décision pour ce qui est des exemptions possibles à ces restrictions de voyage? On sait qu'il y a une solution qui a été trouvée pour les athlètes olympiques, paralympiques, pour le 2000 $. Il y a des gens qui sont très inquiets, qui doivent aller à l'étranger se faire traiter, peut-être pour un traitement médical, ou par exemple des gens qui doivent se déplacer pour des motifs humanitaires, funérailles, des gens malades, etc. Des gens qui sont très inquiets, qu'est-ce que vous pouvez leur dire aujourd'hui?
On sait déjà que des travailleurs essentiels sont protégés et n'ont pas à subir les mêmes restrictions. On a besoin de pouvoir compter sur nos camionneurs, sur les travailleurs de première ligne dans notre système de santé qui, des fois, doivent traverser les frontières. Nous cherchons à garder les Canadiens en sécurité, mais nous allons aussi regarder s'il y a des exceptions nécessaires, souvent au cas par cas, pour des gens dans des situations particulières. Notre but, c'est pas de punir les gens, notre but, c'est de protéger les gens et de décourager tout voyage non essentiel. C'est le travail que nous allons faire. C'est des situations exceptionnelles dans lesquelles on se trouve, mais à chaque étape, la priorité de ce gouvernement, c'est de tout faire pour assurer la protection et la sécurité de tous les Canadiens. Obviously, we've taken significant measures to keep Canadians safe, particularly given the threat of these new variants that are being developed or that are emerging elsewhere around the world. We know that our border measures are in place. There are already a number of exceptions for essential travelers, and we're continuing to look at ways to make sure that we're keeping them safe and Canadians safe, even as essential trade and medical services crisscross the border. At the same time, we're aware that we need to be thoughtful and compassionate about people who are in extremely difficult situations and absolutely need to travel. We're not trying to punish people. We're trying to keep people safe. And keeping Canadians safe from the viruses and discouraging all non-essential travel and ensuring that if people do have to travel, they're doing the things that we can be certain are going to prevent the virus from spreading further in Canada, particularly given new variants. We will continue to work with people and the ministers involved. We'll continue to watch closely for additions or adjustments that need to be made to these measures. But every step of the way, what we're doing is to keep all Canadians safe.
Hi, Prime Minister. Tom Perry, CBC. The Canadian Civil Liberties Association says if you're going to make people stay in these hotels at their own expense, possibly make them quarantine in a government facility, you need to do this based on evidence. What evidence do you have that Canadians are ignoring existing quarantine rules and that these new rules are necessary?
The initial quarantine, the initial testing on arrival needs to be a PCR test. Everyone who arrives everyone who arrives in Canada has a test, a PCR test, over the past 72 hours. So we know that even if they start to develop the virus inside of them, it'll still be at reasonably low numbers, which is why a rapid test on arrival is not as good as a PCR test. That PCR test, particularly if there are significant numbers of travelers, could take 2 or 3 days to get a result. As soon as they get the result of that PCR test, they will be free to go home and quarantine themselves. It's not a punitive measure to keep people in quarantine for 3 days while they get the result. It's just so that we can get a negative result off of that test. Now, anyone who shows up at a border crossing without an adequate quarantine plan already is directed to quarantine facilities approved by PHAC so that they can do it safely. Many people will choose to do it because particularly in cases of new variants that are much more transmissible, it becomes extremely difficult to quarantine in a home and not pass this new variant to anyone else in the home because it is much more transmissible. So every decision we're taking is based on the best possible evidence and will continue to be as we do everything we can to protect Canadians from the threats of these new variants. La décision qu'on a prise de demander les gens de rester 3 jours, c'est pas une punition, c'est pour permettre aux résultats du test à être analysés. Le test de dépistage qui va se faire sur l'arrivée va prendre en moyenne 2 ou 3 jours pour avoir les résultats. Dès qu'ils ont un résultat négatif, même si c'est juste après une journée, ils vont pouvoir rentrer chez eux pour faire leur quarantaine au complet si ils ont un plan adéquat pour la quarantaine. On sait que même maintenant, quand les gens arrivent à la frontière et expliquent, ils présentent leur plan pour une quarantaine, s'ils n'ont pas un plan adéquat, ils sont dirigés actuellement vers des centres de quarantaine du gouvernement pour s'assurer qu'ils puissent se protéger et protéger tous les Canadiens.
And on vaccines, you've got some good news from Pfizer today, but Manitoba said yesterday it's going to strike out and buy vaccines on its own. So I'm wondering, do you think that's political, or do you think that there are people out there, premiers even, who don't buy your assurances that you're going to get all these vaccines you're promising?
I think all Canadians want to see us all doing everything we can to get everyone vaccinated as quickly as possible. I can tell you that the federal government has secured and paid for enough vaccines to get all Canadians who want it vaccinated by this September, including the entire population of Manitoba.
French, no. Hello, Prime Minister. It's Annie Bergeron-Oliver with CTV National News. The number of cases of the variants are growing, and medical officials are warning people that we could be facing a third wave in the next coming weeks if we don't get this spread under control. But still, Alberta and Ontario are reopening. You just said that nobody wants to see a third wave. So do you think it's responsible for the provinces to be reopening right now, despite these dire warnings? And what would it take for you to invoke the Emergencies Act to try and slow down this spread?
I think all Canadians are worried about these variants, and we need to be. We have gotten used to, over the past many weeks, making a number of sacrifices that have successfully brought the numbers down in terms of caseloads. We're going in the right direction, and that's a reason for cautious optimism. But at the same time as these new variants are starting to spread through the communities, we're going to need to be extra vigilant and extra careful. And obviously, citizens should continue to keep their contact numbers down. We should continue to be doing the things we know we need to do, like wearing masks and downloading the app. I mean, as certain restrictions are perhaps released by certain provinces, and people get to go out a little bit more, all the more reason to download the COVID Alert app, which will help you as you get out there in case you come into contact without knowing with someone who later tests positive. These are the kinds of things that we can do. We need to continue to be vigilant. As a federal government, we've given tremendous supports to businesses, to families, and to the provinces to allow them to make those decisions to keep everyone hunkered down a little longer. We will work with the provinces on the decisions they take, but at the same time, I think everyone understands that we need to be extra vigilant as we enter this phase of potential spread of these new variants. That's why things like contact tracing, rapid testing, the app, and continued careful choices by all Canadians not to gather and to keep distances are our best chance of getting through in the best way possible to the mass vaccinations that are coming in the coming months.
But why reopen if we could be in a third wave within weeks?
We make our decisions based on the best recommendations of our health officials, and as a federal government, we will be there to support and encourage the right decisions by the provinces.
Hello, Prime Minister. I'm Mike Blanchfield, Canadian Press. You just mentioned rapid testing just a moment ago. How is the federal government using rapid tests in its areas of jurisdiction? If we have a lot to spare, Would they be useful at borders, notwithstanding what you said earlier, to speed things up in remote Indigenous communities, prisons? Let's hear more about what you think the federal role in rapid tests should be.
I had extensive conversations earlier this week with a number of ministers. We're looking at using increased rapid tests in federal institutions like prisons, looking at using them in various ways. We know that they are an important part of the process, particularly as we come towards the spring. And we'll have more to say very soon about all the different ways we're going to be using the millions of rapid tests that keep coming into Canada. Nous reconnaissons que les tests de dépistage rapide sont extrêmement importantes comme mesure additionnelle pour protéger les Canadiens. Le gouvernement fédéral est en train de regarder comment en envoyer plus aux différentes entreprises, les utiliser dans des institutions fédérales comme des prisons. Nous allons utiliser ces tests rapides comme mesure pour continuer à garder les Canadiens en sécurité.
David Aiken, Global News. Good morning, Prime Minister.
Good morning, David.
I'd like to come back to some issues around General Vance. We've been reporting that he was investigated by military police in 2015 about his conduct while he was serving as the deputy commander of a NATO headquarters in Naples, Italy. So first, were you aware of that 2015 investigation? And more broadly, and we've asked before, but we have not heard you answer this, were you aware of any concerns about General Vance's behavior towards subordinate women?
First of all, I wasn't yet Prime Minister when General Vance was selected in 2015, so there are processes that happened before we came into office that I can't speak to. At the same time, I want to reassure everyone that we always take these allegations extremely seriously. As a government, we have strengthened our measures in place. We have empowered the processes that oversee and investigate and review these issues, and we will continue to make sure that all the right steps are followed, that we continue to ensure that everyone has the right to a safe workplace, whether they work for the Canadian government, the Canadian military, or quite frankly, any workplace in this country. It's a commitment that we take very, very seriously, and we will continue to do everything we need to keep everyone safe. Je peux rassurer tout le monde que notre gouvernement prend très au sérieux la responsabilité d'assurer un milieu de travail sain et sécuritaire pour tout le monde. Nous allons toujours suivre les règlements et nous avons toujours cherché à accroître les processus et les outils pour assurer la sécurité de tout le monde et un suivi sur toute allégation. Merci. Bonne journée tout le monde.